Shingles is an infection caused by the same virus that causes chickenpox. It's also called varicella zoster. Unless you've had chickenpox before, usually when you're a child, you cannot develop shingles. Shingles is also called herpes zoster. It's most common within people over the age of 50, but young people can have it too as well, as long as they've had chickenpox. If you have had chickenpox, you are at risk for developing shingles. After you recover from chickenpox, the virus stays in your body. It moves around in your body and roots into your nerve cells and becomes inactive. And then later in life, it becomes active again. And shingles is the name that's given for the symptoms. It's unknown why the virus may become active again. It may be because of a weakened immune system. It may be because you're taking immune suppressing medicines, or if you've had major surgery. It can also happen if you have cancer, if you have AIDS. Also, if you chronically use cortisone drugs, it may trigger shingles, and the virus can become active again after the skin has been injured or sunburned after periods times, and emotional stress can also trigger shingles as well. Normally, if you have shingles, you start with burning or sharp pain, numbness in or around the skin. One side of your body or your face might go numb. The most common site is the back or the upper abdomen. You can have itching and aching. You can feel tired and feel ill with fever and chills and a headache and upset stomach. 1 to 14 days after you start feeling the pain, there will be small blisters on the reddened skin. Within 3 days after they appear, the blisters will then turn yellow, and then they'll dry and crust over. Over the next 2 weeks, the crust will drop off. They might leave small pitted scars. The blisters usually are found in a line because they follow the nerve path. They follow from the back around the abdomen. Most always they're just on one side. Normally they don't cross the middle line of the body. The rash may also appear on just one side of your face. Some people may experience painful ear and eye inflammations and infections. The pain can last for weeks, or they can last months, and it can even last years after the rash is healed. That is called postherpetic neuralgia. Shingles is not contagious. If you've never had chickenpox, you can get it though. If you can get chickenpox if you contact someone who has shingles, because the blisters contain the same virus that chickenpox has. So if you do have shingles, you want to make sure that anyone who has not already had chickenpox or has the chickenpox vaccination does not come in contact with your blisters until they are completely dry. Once the blisters are crusted over, they are no longer contagious. You go to your doctor will ask you questions about your medical history and look at your symptoms. It's normally pretty clear from just the look of your skin if you have shingles. Your doctor might order some lab tests though to see what kind of virus and to look at it. If you do have a rash, you might want to start the treatment as soon as possible. contact your healthcare provider to talk about treatment or medicine that you can take. The medicine is most effective if you take it within the first 3 days of the rash. Also, antiviral medicine will help speed up the recovery and lessen the pain and the time that the pain will last. Your doctor might recommend some medicine for you for the pain. He might give you some antibacterial lotions and specific medicine if you're over the age of 50. Within 1 to 2 weeks, the rash of shingles should heal, but the pain and the irritation will usually go away in 3 to 5 weeks. The virus can damage nerves. You may have pain and tingling for months and numbness for years, maybe after the rash is healed. The chronic condition is most likely to happen in people who are over the age of 50. If they've had a shingles outbreak, they can take a prescribed medicine during the time the shingles is diagnosed. It can be taken for 7 days to help prevent it becoming chronic. Shingles can occur on your head or your scalp. The symptoms might include a headache, the weakness of one side of the face. If you have a lot of weakness on the face muscles, the symptoms usually go away, but it can take a few months. You can take pain relief medicine to help reduce the pain, or any other medicine that's prescribed by your healthcare provider. You can use cool rashes or cool washcloths to put on the rash and put on your body. You can rest in bed during the early stages. When you're sleeping, try not to let your clothes and your bed linens rub against your rash. It can irritate it. You call your doctor if you develop more pain or a fever, if you develop a stiff neck, hearing loss, changes in thinking. If the blisters you form have bacterial infection, or if they have a yellow drainage, or if the blisters are close to your eyes. You can prevent shingles. If you've never had the chicken pox, you can get a shot to help prevent the chicken pox, the vaccination. Also, you can get a vaccination for people who are 60 and older. The vaccination can help prevent and lessen the symptoms of shingles, but it cannot be used to treat shingles. You can protect your immune system and lessen your chances of getting shingles and keep your stress control level down.